Welcome. I'm Dr. Jerry McGuire, founder of STARS, and I'm the host of our STARS podcast, STARS Speak, Understanding the Science of Stuttering, where voices are heard, understanding of stuttering grows, and awareness moves forward. Each of our episodes include unscripted and honest conversations with researchers, clinicians, and individuals dedicated to advancing the science, research, and understanding of stuttering, a field really that deserves greater attention, collaboration, and research. So I'm honored today to be joined by my friend and colleague, a great stuttering researcher and clinician, Gonçalo Leal. So Gonçalo, tell us a little bit about yourself. Where are you? What have you done? And what do you do?
Okay. So, as you said, I'm a speech and language pathologist, and I'm based in Portugal, in Lisbon. I'm the clinical director of Speech Care and I Stutter Center. We work not just in Portugal, but also in Spain, in UAE, in Abu Dhabi. But also, I have experience working on clinical education in Europe, South America, Africa, Middle East. So I'm, like you said, I work in these different areas, not just on a clinical level, but also research and teaching.
Wonderful, Gonçalo. Thank you. You also have a personal connection with stuttering too, correct?
True, absolutely. My wife, she's also an SLP and a person who stuttered.
Wonderful, great. Thank you. That's a little inside information that I had. So that's good. Can you tell us what got you into this field? Why stuttering?
So when I choose speech therapy, part of my passion was, of course, human communication, but I also have a deep passion on neuroscience and mental health. And when I was doing the program in those days, at the end, you should do an academical work. And I was very divided between language disorders in adults, on neurological disorders like aphasia or stuttering. But my work was doing interviews about quality of life of people who stutter, talking with people who stutter. And it had a deep impact on me. It was so different from what I, until then, reading on the books or in the classes, talking in firsthand with people who stutter. That was the trigger for everything that came next. And I think I'll never forget those interviews and all those experiences. And most of all, a lot of them don't have any faith on therapy when I discuss with them. In those days, therapy in Portugal was very based only on acceptance. And so for me, it was, okay, I have to do something. And this will be my path. And I believe that I have probably because of that experience.
Great. So you bring that forward. You say, hey, there's this unmet need and also this passion, which is great. I think that's where the best of us in healthcare, what we actually strive for. So I actually thank you very much as a person who stutters for that. Where would you say the state is of our stuttering therapy now? I know you mentioned Portugal. What is the state of this today?
So this is a very long question, and with a lot of.
Well, that's my role as psychiatrist, not to talk much, but to get others to talk.
So I think that it's really interesting to see in these last 2 decades what happened in the fields and the increasing number of research on neuroscience regarding etiology. So more and more we understand about what can possibly cause stuttering and all the implications. But at the same time, on a therapy level, I think there's a lot of things that we need to do and we need to go further. I don't feel that this knowledge of neuroscience is coming together with therapy. Of course, we increase a lot of our knowledge, looking to a more multidimensional perspective of therapy. Probably in the past, people were very focused only on speech or only on acceptance or only on other psychological aspects. More and more, the therapy is bringing together different perspectives and more centered on the individual needs. And I think that's great. But on the other side of the coin, I feel that we have a lot to work and to move forward, bringing all this knowledge together from the research to the clinical field. And I think we are on the good path right now. We see more and more discussions between different professionals like stars are
Yeah,
doing, and I'm incredibly happy because of that.
great. Thank you for that. Uh, uh, you're a founding member of STARS. We've thought of this together for many years. What compelled you to help in the formation of STARS?
So, my like I said before, I believe, and we see this in other fields, like neuroscience is bringing so much knowledge and so much partnerships and interactions with different professions to go deeper in different conditions. And I felt that in stuttering, that wasn't exactly what was happening. I felt that people were somehow spread, and also believe that we move forward through discussions, honest discussions, and put people in the room who can think differently and discuss, and together can find new paths, new hypotheses. And I'm a strong believer on collaboration. I'm a strong believer on not being attached emotionally about what I'm doing, except the emotion of put people who stutter in the front line of my goals. So my vision for stars, and I'm so glad that's exactly my experience about what we are doing. It's bringing different people with different backgrounds, with different experiences, and put them together to discuss new paths and new hypotheses. And we also, and I'm remembering about our discussions, and also, of course, my clinical experience, see that it's really interesting because we hear a lot about critics about the medical model on stuttering. But on the same time, we don't have too many medical doctors knowing about stuttering and working on stuttering. Of course, I understand what medical model means, but part of the equation that I was feeling it was missing, it was this discussion between speech and language pathologists, psychologists, but also MDs, not just psychiatrists, but neurologists. And we know a lot of comorbidities on stuttering, and we should bring other people on board to address this as a team.
Great, thank you. And speech care is doing that, correct? You're by the few
Yes,
clinics
yes,
that has
yes, and
spread.
and that's the part of the, as a clinician, what I felt on my early years in my career was the need of growing faster, and the research sometimes, it's I can use this example. It's like a clean model that everything is amazing. The person you have in front of you just stutter, and it sits in front of you, and you use some kind of techniques or therapy, different programs, approaches, whatever, and it worked perfectly. And the real world, it doesn't work like that. People, we know, data show us people who stutter, a huge percentage of them have other conditions that can make therapy very challenging. We know the impact of these comorbidities also in mental health that bring even more challenges. So we understood that we need to accelerate our knowledge, and the idea since the one was bringing other professionals that can together provide a multidimensional care for people who stutter. So that is our experience, and must very successful, I must say. So that was probably the reason I believe deeply in this model, and I feel this absolutely need to increase the knowledge with other fields of health, and educate medical doctors about stuttering. I think that's crucial.
It is great. So thank you. And you are helping us with that together with
Thank
that as
you.
well too. And so yeah, just to speak to that a little more, we know that too much of healthcare is siloed, meaning it's here and here and here. We know that the best outcomes, at least for the conditions that historically we treat in psychiatry and neurology, bring in interdisciplinary care. For instance, aphasia, right? Speech pathologists work with neurologists. Um, uh, Individuals with dysphagia, right? ENT, swallowing disorders, work with speech language pathologists. In psychiatry, we work very closely with psychologists and social work. And um, so it's as we gained knowledge in the neuroscience, more people came into therapy because our multidimensional approaches became more effective. And I think that's when we understand the neuroscience, I think the stigma goes down. So I think everybody's looking for the same goal, but I think bringing people together is going to really achieve that goal. And so that's where I really, when you broadcast, what are those coexisting conditions that you say? What is it that you see as a clinician that people who stutter struggle with and may not be adequately addressed, just partly because of the lack of training and knowledge among the medical profession about that? What are those conditions that we may not?
So thinking in children,
Mm-hmm.
for example, what we see it's a lot of comorbidity with ADHD,
Mm-hmm.
and it's really interesting. And this also make us think because we saw with some children with medication they increase
Mm-hmm.
stuttering, some children with medication they decrease, and
Yeah.
some it doesn't affect stuttering at all. So
Right.
for
And it
us,
depends on the medication, right? For a
absolutely,
child, is that right?
absolutely.
Yeah.
It
Mm-hmm.
depends on the medication and probably the etiology of that specific child about the stuttering. So since day one on a clinical level, we start to think probably we have children who stutter for different reasons. And probably that's why also medication can work differently in each of these kids. And so we felt the need to articulate very closely with these child neurologists or child psychiatrists who medicate these children, and together because we had in the past a lot of children who gave up on medication for ADHD because of stuttering. So the parents didn't want them to take any medication and try new medication because I remember a specific child an adolescent, who was like from mild to moderate stuttering went to very severe when he started medication, and the parents they didn't care about any medication after that. And what was happening to this young boy, he was struggling in school because of attention deficit. So um, this is one of the cases. But when we talk also about adolescents and adults, when we talk about them, and we see that a lot is comorbidities with mental health disorders. We see. I was this morning receiving the information, the medical records about a patient that he stuttered, but also have social anxiety, also have depression. He's medicated for this, probably not doing the right treatment. He also have OCD, so a very complex case that requires a team working together to make a difference on his life. I can also remembering several children who came with the diagnosis of Tourette syndrome, some of them incorrectly diagnosed and with Tourette syndrome, some of them with Tourette syndrome and stuttering. So all these cases require a team that are on the same page, talking the same language, so can make a real difference on these on people's lives.
That's great. Thank you for sharing that. And we get lots of inquiries through our stars website. But just going through our records, and we're about essentially a year old now, not even quite. But we've received hundreds of inquiries, and hopefully get to all these. That's why we're doing the podcast. It's difficult to type out every answer, but I have to ask. One common theme is, I'm a new parent. My child is stuttering, begins to stutter. What do I do? What do you say to that parent? How would you answer that question? I may send you all these emails, by the way, but how would you answer? How would you answer that question? A parent, a grandparent is looking at their child today. What do you do?
So first of all, I always recommend to look for a specialist, a stuttering specialist, and a speech and language therapist, because we know children. We have knowledge regarding some risk factors for stuttering persistence. If I'm talking about preschoolers, but we also know that every child is unique, and all the families are have different dynamics and knowledge. So I think it's really important that family found a specialist who can understand the family dynamics, who understand the child, of course, to confirm the diagnosis. But I must say that probably like stuttering diagnosis is the easiest in the world in speech therapy,
It's
because
easiest
first
in
of
medicine.
all,
I
it's
knew
so
at age four I
easy.
stuttered. Yeah, but right? Yeah.
It's yeah, because the family knows. First of all,
Mhm.
usually
Right.
in my whole career, and I saw hundreds and hundreds of kids who stutter and their families. I think only once it wasn't stuttering,
hmm
because
Now, when you bring
usually,
that up, though, we have different types of stuttering, though. Correct? You
absolutely, yeah,
alluded to this a
yeah.
little bit more. So we say that diagnosis. Okay. So the key is getting into a speech language pathologist early.
I think the key is getting to the speech pathology early. Of course, the key is also the family receive information about how to deal with that child as soon as possible, because we
hmm
know that a family who receive information about how to deal with a child who stutter, it will reduce a lot some of the behaviors or the way they are interacting with the child that unfortunately can cause more stress, more reactions, and unhealthy reactions in the child, because if the child feels that there's something wrong, that the way I'm talking, it doesn't please my mom or dad, I probably will try to do things. And we know that mostly children who have a more reactive temperament, the reactions of family can have an impact on the severity of some of the behaviors. So this is something important, because the experience
hmm
um, have impact on how the child cope with stuttering. And we know as soon as this family receive advice, the better. But we also know that general advice, let's say a family come and I give some advice and they go, usually it doesn't work. So people need guidance, and that's why speech therapists are here, not just to guide the family, but when needed, work directly with the child. So I must say, like, the best advice is looking for a speech and language therapist who are specialized on stuttering.
Great. Now, what about the other way? We talked about that physician, that pediatrician referring to
Yes,
speech language pathology. What about the other way?
yes,
We don't hear much about this. When should that
you're
speech
right.
language pathologist
You're
refer
right.
back to that physician? And when does that occur?
Usually doesn't, and you're
I know
absolutely
that's
right. What yeah, what I
yeah.
do, what I always do with in our center, a lot of pediatricians, they refer kids who stutter to us, and
hmm
we have some materials for the pediatrician about stuttering. So we always send them to the families, and we try to reach them so they can we can interact and see exactly how we can work together. We are having more and more data that, for instance, sleep affects also stuttering. Other conditions on childhood can also affect stuttering. I believe in the next years more data will come, and with all the studies on genetics, we will understand other comorbidities that somehow can affect. We know also, and you have papers on this, about some autoimmune conditions that can trigger stuttering, and probably they need medical care in an early stage to. So and it's interesting your question, because sometimes we do this contact on a very general level, but definitely we should um, like think how we can do this on a more individual level, and how exactly we can reach that pediatrician to make a difference on this child life.
That's right. That's why we're working together because it's just so much unknown. We think about
You're
this.
right. You're right.
We've
Okay,
spoken about this, and then I think, but that's why STARS is getting together a multidisciplinary consensus, I would say, or at least guidelines, or at
absolutely.
least some pathward forward. Because to me, that's one of the biggest issues: is what does that physician do to help this? Because they're lost. They are.
They are, and
They
let me share
really
a
are.
story. Let me share
Yeah.
a story because I think this story can, and probably now thinking about on the side of a speech and language therapist,
Yes.
sometimes we can have these almost bias thinking that medical doctors are aware. But I had this experience in the past that for me it was a game changer. So it was an adult who stuttered in a very severe way with several comorbidities on neuropsychiatric comorbidities. And he went to a neurologist, very known in my country, who is also a person who stuttered. So I didn't send, like usually when they go see a medical doctor, I send some, at least some papers, some research papers, so they can be aware. But my thought was, okay, this is a person who stutters. He's a neurologist, specialist in movement disorders. He knows. That was my thought.
Yeah.
So when my client went there, he was medicated with levodopa. I think it's the same name in
Yeah.
US.
Yeah.
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 Okay.
So it's going to increase dopamine. Okay. I'm
The
curious.
result, the
Yeah.
result was a
That's
nightmare. It was.
That's right. Would
I
make it worse.
was
Normal
shocked.
usually makes it worse. And that's why I think some of the medical literature, I see things where Parkinson's stuttering, or I see stuttering related to an olanzapine, which is really a tardive phenomenon. It's a withdrawal of the effect. And so we don't have the groups aren't together, and they're disparate in their knowledge. And that's,
But
yeah,
to finish the story, the barrier was in my mind because when he got really worse, I reached the medical doctor, and later I talked with him, and he asked me why you didn't reach me, why you didn't tell me anything, and I was like, yeah, you're absolutely right. I
yeah,
assume that he said in the med school we don't talk about stuttering.
none. None.
Um,
Yet we label it. Physicians have labeled
yeah,
this.
yeah,
And I think that is what it really has impeded the access to care for our patients, because there's a lack of knowledge, just a lack of knowledge. And to me, that's led to even greater stigma and barriers. This is leading to the bullying of a child and others, because there's lack of knowledge in this.
absolutely.
Uh,
And
and so,
my
mhm,
experience when now we submit to talk in medical conferences about stuttering, people have a lot of curiosity.
they do,
They love to hear about it. They're very curious about it. Once they understand where we are right now, a lot of them want to be involved. So
they do.
the experience is really good, and that's why also I'm so happy what stars are doing, participating in medical conferences, doing lectures about the topic, because I know we'll bring more people to the field, and we need all the people that we can get to think about it, to study, to do the clinical interventions as well, the treatment. So I think this is a great path that we are doing.
Yeah, because and the other thing too is that we're fortunate that we're stars, that we're providing all this information to our clinicians around the world free. That's our goal.
Yeah,
We're doing that. It's um, so because there's a great deficit in knowledge about stuttering in the greater healthcare field, beyond speech and even within speech language pathology. We need to reach more people. But beyond that, you're right. So there's been some thought that, well, a doctor should know this. They've had, we've had zero training on this. Zero training. So
absolutely.
yeah. Right, Gonzalo. Well, thank you. You shared with us some really exciting possibilities ahead. But maybe share with us, do you have any concerns about the field going ahead?
Okay.
Or yeah.
Yeah, I think concerns is
Or is that the right word? How would you say
no,
it?
no, it is, and I was thinking about the possibilities we have right now and what is going on in the field that can bring new knowledge, new tools. That is very exciting, like technology and AI, and we can discuss about that. Regarding concernings, and not talking about technology in my experience with some startups of some groups on AI. Some of these groups they feel there's a kind of resistance from some clinicians or even some stuttering centers regarding to explore different possibilities. I think, and I mentioned earlier that my wife stutters, and that's why we
Mhm.
create the stuttering center. It was one of her dreams. In fact, I'm living her dream. But part of the values when we create the research center was this vision of partnering with people who want to do more, who want to bring new things for people who stutter.
Okay.
And part my concern is probably I believe this sometimes happen because people are not aware about the potential that technology can bring. I think sometimes, and we know these people have some fear that technology can change somehow the possibilities of how professionals work or
I see,
taking
right?
any
Kind of fear
jobs
that they
away.
that drops right. I see that
Yeah,
even too, that people think, hey, if we have a pill that comes out, we don't need therapy. And I'm
yeah,
like, that's never happened. Because like
yes,
in
yes,
fact, if anything, when we began having efficacious treatment, say for OCD, we never had anything. More people came in for therapy because there's a little more hope. Say, hey,
yes,
I never got anywhere before. And then they come and say, well, this pill's got me this far. Now I will go back.
yeah.
So I think you're right. I think it
Absolutely.
could only enhance. I'm hopeful, right?
And
And if we do
it
this right,
can.
it'll just
It
enhance it.
is.
It should.
It will
Mhm.
enhance because, but we need to study, we need to research, we need to increase hypotheses, and hypotheses are raised based on discussions. And again, that's why when we discuss about what stars can bring, it's room for these discussions, multidisciplinary, not trying to introduce bias in people who came and try to bring their ideas. I think it's amazing to hear ideas who are different from the ones that we have. And so part of my concern is I don't think we are creating yet enough room from people from engineering field come with their ideas and also to listen our problems, the problems we face on assessment, on therapy, that people who stutter have on their therapeutical processes. So I think we should increase this interaction. Um, and then I believe that another concern, and this is probably based on my work, traveling to different places, different cultures, interacting with people who stutter from very different backgrounds. It's not forget the individuality. And like I was saying in the beginning, sometimes the theoretical part it doesn't match with the reality we have in the clinic when I have someone who are struggling today that needs something to work, not tomorrow, but today, in people who some people who are so severe that they almost can talk orally, with a severe impact on their daily life, on their dreams. So I think we also need to look to the world. The world is a very big place and understand people's struggle in different societies who doesn't have any knowledge about stuttering, huge stigmas, strong beliefs. So this is something also sometimes research concerns me because it's assumed that what I found here it can be applied all over the world, and I don't see that in real life.
What would you hope our audience takes away from the conversation today?
Okay, so first, and this is something it's really interesting when I talk with
Mhm.
my with people who stutter who are on our center. When I talk with them about stars, they get so excited because they feel that there are people who are dedicating their lives, their time to find new options, new solutions, new therapeutical alternatives, and so for people who doesn't know stars, I think this is one of the messages that at stars we will not let anyone behind, and our discussions it's to include everyone, to think about options to everyone and based on their needs. So this is the first. The second is this discussion between psychologists, psychiatrists, speech and language therapists, neurologists, and so many professions, and also people who stutter who are also part of STARS, our consumers board, let's call it like that. it's so helpful, and I'm really excited what we have ahead of us.
Well, I want to thank you very, very much, Gonçalo. I want to thank you for your vision, your support, your time, your effort, your volunteerism in helping us move this very important mission forward. And I thank you for your support and great work for those of us who stutter. So thank you today.
Thank you so much, Jerry, for having me, and thank you so much for making stars a reality. Thank you.
Thank you. So for those, if you have a question or topic you'd like us to cover, visit our Get in Touch page on our website. And we'd love to hear from you. And don't forget to subscribe, follow, and rate the STARS podcast, STARS Speak, Understanding the Science of Stuttering, to help us reach more listeners and grow awareness about stuttering research. And if you are a healthcare professional, want to learn a little bit more about stuttering and how to help your patients or clients, please take advantage of our free education, CME, Continuing Medical Education credits, and they apply to other healthcare professional licenses as well. And that's available through our joint sponsorship with our academic partner, St. Louis University School of Medicine. I thank you all for listening, and we will see you next time on our next episode of STARS. Thank you very much.